Root canal, one of the most dreaded words in dentistry. The minute I say any patient that you require a root canal, everybody wants to jump out of the chair and go. That is primarily because of a lot of misinformation that is available about root canals. So today I'm there to clarify every single misinformation that is there about root canals. What is a root canal treatment? Let me try to explain this in as simple terms as possible. To understand this, let's first understand what a tooth looks like. The tooth has three layers. Layer number one is enamel, layer number two is dentine, layer number three is pulp. And then you have your roots, and then there is actually a canal that runs inside the root. Now, what is a root canal treatment? When I have to treat the canal that is inside your root is what we call as a root canal treatment. So what exactly do we do in this? When a cavity starts from your first layer, enamel, and then it goes to your dentine, all we do is remove this cavity and put a cement and fill it up. Now you leave it, you don't address it at this stage. It goes to the root or the canal that is there inside the root, and that infects the canal. Now I have to clean the canal that is inside the root, which is called as a root canal treatment. Now, who requires a root canal? The most common scenario where you will have to get a root canal done is when you leave a cavity to a stage where it's going to cause you pain. Because the minute there is pain, the cavity is already touched the pulp or the root tips. So now we have to clean till the tip of the roots and fill till the tip of the roots. This is what we call as a root canal. Second scenario, maybe you had a fall, the tooth breaks to an extent where it breaks more than your dentine, you might still require a root canal. Point number three, very rarely in case where you have to go for a cosmetic treatment or when you go for a bridge, what we call as an intentional root canal we'll have to do before we go for a prosthetic treatment. One of the biggest misinformation about root canal today is it is one of the most painful procedures in the world. It's not the case. Gone are those days where any procedure was done saying this is going to be painful, please bear with it. Today, with good amount of expertise, a lot of good anesthetic agents available, with a lot of technology in hand, a root canal is one of the most painless procedures that you can have today. So, with the fear of it is going to be really painful, please do not delay seeing your dentist, and please do not lose your tooth, which can be saved. How many sittings will a root canal take? Typically, with good amount of expertise, 90% of the cases we are able to finish it in one sitting. Some cases may require 2 or 3 sittings. So what determines this number of sittings is actually not the dentist. It's the amount of infection that you already have. If you have an abscess or a collection of pus that is set in, you need to give nature its time to heal. We cannot finish a procedure before the abscess is completely healed. And this is what is going to determine if the root canal can be finished in a single sitting, in 2 sittings, or 3 sittings for the fact. Do root canals last forever? This is one of the most commonest questions that I face. There are 2 factors which determine the success of the root canal. One is how the root canal has been done, the expertise in doing the root canal. Number 2 is going to be your maintenance. There is no way in saying a root canal treated tooth will never get reinfected again. Just like any medical procedures, a root canal also has a small amount of failures. But millions of root canals are being done every day in the world, and they last for really good number of years if you maintain them properly. So in this whole the time that a tooth lasts you, you are going to chew and eat efficiently with that tooth. I think that is what is very important, and this is what makes doing a root canal worth it. There are a lot of people telling if you do root canals you'll get heart disease, any other cancers, or you name a disease, it's because of a root canal. There is no relevant studies that show there is any connection between a root canal and a root canal causing any other diseases in the world. It's one of the safest procedures that you can do. Even if you're a patient with a heart disease, we can still take enough precautions to do a root canal and still have a good success rate with it. So anybody telling you that a root canal causes some other illnesses is a misinformation. Please read before you make a decision. Is there any alternative to root canal? That's another commonest question that I face. Whenever a tooth is infected to an extent where it will require a root canal, the only other alternative that you have is to remove the tooth. There is no other alternative treatment. So instead of removing a tooth, the basic principle is to save the nature or save God's given. So that is one of the main reasons why we go ahead and do a root canal and not extract a tooth.